Hello everyone, I am Dr. Srinath, consultant neurosurgeon at Renova Hospital, Kompally. Today I am coming in front of you in order to give a few description about the topic of brain tumors. Brain tumors we encounter most commonly. We have two types of brain tumors, which is the malignant or the bad kind of tumors, and the benign tumors or the good kind of tumors. Most of the tumors which we encounter are bad kind of tumors or glial tumors, which are malignant in nature and grow in spite of different types of treatment measures. Whenever we discuss the term brain tumors, the symptoms of the brain tumors are most commonly inquired for. The most common symptom which we encounter is the headache, but it itself does not mean that all patients with headache are having any brain tumor. So headache is the most common symptom which arises because of the increased volume of the tumor inside the cavity of the skull, leading to raised pressure inside the brain and causing the headache. The other most common symptom which we encounter is the seizures or fits. The normal brain, which is beside the tumor, is being irritated by the tumor and therefore causing the abnormal function of the brain cells, leading to seizure or epilepsy, which we describe. So the presentation of the patients, which can be most commonly, is because of headache or seizures. The other symptoms which we can be encountered for such conditions is the weakness or numbness of certain parts of the body depending on the location of the tumor, where we encounter hand or leg weakness, speech disturbances, bowel or bladder disturbances, a cranial nerve location which we have like vision, smell, hearing and balance, and also swallowing difficulties, and the other symptoms such as weakness of the different parts of the body. And apart from this, the other common symptoms are the psychiatric symptoms, where the location of the tumor shows exact problem which is being evaluated. So most commonly we advise the patient to undergo a scan such as the CT scan or the MRI of the brain, and depending on the verification further, we ask for a contrast enhanced scan which can show clearly the margins or borders of the tumor and help us to manage the tumor. So in patients where the tumor size and location is difficult to be managed surgically, and we advise the patient to undergo either a chemotherapy or radiotherapy directly, and in case we can biopsy the patient tumor only without being able to be removed, it helps us to manage it more. So in patients with untreatable or non-surgical management, we usually advise them for radiation therapy such as gamma knife, cyber knife, where the tumor is being treated with electromagnetic radiation such as alpha rays, gamma rays, and X-rays and proton beams, so that the tumor cells are being destroyed at the cellular level and the tumor size decreases. It also can be helped with chemotherapy sometimes. In patients where the tumor location allows it to be removed totally, the total removal of the tumor is always the best kind of treatment which can be given to the patient. Depending on the margins of the tumor, where it can be either totally resected or partially resectable. Total resectable tumors can be considered a cure after removing it totally and confirming it after 1 or 2 more years of evaluation and follow-up. In patients where the tumor cannot be removed totally, we usually follow up the patient care with repeated scans, and in case where the diagnosis is made of a malignant tumor based on the biopsy, we always advise the patient to undergo medical management further, such as chemotherapy and also radiation therapy. We also have the responsibility of regular follow-up in such patients in order to check for any regrowth of the tumors, any new location or any new tumors arising in other parts of the brain, and also in order to prognosticate the patient about the future and also the result of the treatment, and allowing the patient to take a decision and further care such as rehabilitation, physical rehabilitation and occupational rehabilitation. In patients with location where the tumor cannot be removed by open methods, there are also other methods called endoscopic methods, which can be used to remove tumors located in the ventricles of the brain, or through the nose we enter the pituitary fossa to remove the pituitary gland tumors. We can also use this process to augment the open procedures, where an endoscope is used along with the open procedure to remove the maximum extent possible of tumor. So we always advise these patients to have a regular follow-up and keep the doctor advised about his symptoms in order to have a best result. Thank you.